the workarounds that all of us are doing to try to stay in touch as we try to deal with this pandemic. This town hall is focused on the northern part of my district, a place I love and really cannot wait to visit when this public health emergency is over. But I'm coming to you right now from San Rafael in the southern end of my district, and that's being made possible by the Community Media Center of Marin, also known as Marin TV. The team here at the Marin TV studios has just really been doing a great job of keeping the lights on to provide public information, which is really an essential thing during this crisis, and even when we're not in a crisis mode as well. So I want to thank them for their service to this community and for safely working with me and my team. Thanks also to the partners who are making this broadcast available tonight. Humboldt Access, of course, is broadcasting this live on Channel 10 on Suddenlink Channel 10 up in Humboldt County. And you can stream online at YouTube/user/access Humboldt/live. You can also listen to this broadcast on the radio at KZZH, that's 96.7 FM. And I believe KSRO in Sonoma County is also covering this town hall tonight. We will be broadcast as well on Marin TV, the education channel. So down here in Marin County, that will be channel 30 on Comcast, and on AT&T, that's channel 99. Thank you for all of my partners in making sure as many people as possible are able to join us for this community event. I have some excellent panelists that are joining me virtually tonight. I will introduce them in a moment. But let me begin first just by wishing everyone the best, hoping everyone is staying safe and staying home so that we can limit the spread of this COVID-19 virus. Like everyone else, I am trying to adapt my work routines to this shelter-in-place reality. And that means using lots of different tools to try to stay in touch, to try to stay accessible to my constituents. Tonight, we're going to use a combination of technologies. Some of you are going to tune in by radio, others are probably watching right now on Facebook Live, or again, some are watching on regular old TV through Access Humboldt or through Marin Channel 30. I will post the archive for this town hall on my website as well. That's huffman.gov. For those who want to, huffman.house.gov, sorry, for those who may want to stream it later. And while I did say that the focus and my panelists are going to be oriented toward the northern end of my district, Humboldt, Trinity, and Del Norte counties, the content tonight is likely applicable and of interest to people throughout my district. And so I really am glad that we're also going to have coverage through our community partners here in Marin and in Sonoma County and in Mendocino County as well. A little bit about the logistics before I introduce the panelists, how this program will go. If you would like to ask me a question, please go to Facebook, and you can find my page by going to facebook.com/Rep Huffman. You can see it on the placard right behind me, Rep Huffman. And you can go ahead and type in your question. My district director, Jenny Calloway, is seated 10 feet away from me. We are doing responsible social distancing, and she'll be shouting out the questions that you submit as they come in a little bit later on. We've already collected some questions in advance, and so we will get started by diving into them first, but we will move to as many questions as possible over the course of our little over an hour together. And I may take the moderator's privilege to ask some questions of our panelists as well. If we do not get to your question tonight, that won't be the last chance to have a conversation about whatever's on your mind. You can join me at any of my weekly Facebook Live office hours. We're doing those every Wednesday at noon. Again, if you go to my Rep Huffman Facebook page, we'll be there Wednesday at noon to continue this conversation. So let's get to the panelists. I am really fortunate tonight to be joined by Humboldt County's Public Health Officer, Dr. Teresa or Terry Frankovich. I'm joined by Leila Roberts, who is the director of the North Coast Small Business Development Center, and also Gregg Foster, who is Executive Director of Redwood Region Economic Development Commission. Leila and Gregg are going to be great resources on any questions about small businesses and the benefits that have been made available through the SBA. And of course, Terry is here to talk about the public health aspects of this challenge. Now, I know how difficult this crisis is for everyone I represent. In fact, I should be more specific. We're really dealing with two crises that are happening simultaneously, a public health emergency and then the economic collapse that it has forced upon us. And we have to fight both of these crises at the same time. On the public health side, I hope everyone is staying home. We really have to do everything we can to slow the spread of this virus so that we don't overwhelm our hospitals and medical providers and the healthcare system that we all count on. And that means shelter in place, don't go out unless you absolutely have to. And hopefully everyone has figured out by now, if you do go out, wear some kind of a mask or a face covering. Now, this is a buff that I wear when I'm fishing sometimes, but I've repurposed it to be my going out mask when I need to be away from home. Anything that you have that's a cloth covering will help you avoid inadvertently sharing virus with others. So please do all of that. On the economic side of this crisis, the federal government has to step up to recognize the fact that families and businesses, local governments, the state government, and states around this country are reeling from a massive economic collapse. Right now, that involves a lot of triage, providing federal resources to help people get through the weeks and months ahead. But it also needs to include a longer term perspective. We are going to need to revive this economy down the road when we get this pandemic under control. And I am actively working on an infrastructure package that I believe has to be part of that national response. Now, Congress has already taken some big steps. So I want to make sure you know that right out the gates, when this crisis became known to us, we passed an $8.3 billion supplemental funding measure, bipartisan support, and that provided billions of dollars for treatments and vaccine research. We need to make sure that that vaccine is not only developed, but it's available and affordable to absolutely everyone. That measure we passed protects against price gouging of medicines developed with taxpayer dollars. It also provides $2.2 billion in prevention, preparedness, and response measures. That included nearly $1 billion to help state, local, tribal, and territorial health systems deal with the surge that we knew was coming. There was a second action that Congress then took within a couple of weeks after that. It was the Families First Coronavirus Response Act. And what this was about was providing families health security by making sure that testing for the coronavirus would be free to anyone who needs it, regardless of whether you have health insurance, regardless of your documentation status. We expanded support for Medicaid. We included economic security in the form of something really rather unprecedented, 2 weeks of paid family leave and 3 months of paid 2 weeks of paid sick leave, 3 months of family and medical leave for workers who don't have those benefits. Also some additional support for small businesses by reimbursing them for the leave they provide their employees. And then also some shoring up of our food safety net, nutrition assistance to strengthen SNAP, student meals, senior meals, and food banks. So that was the second thing. And then a really big one, a couple of weeks ago, the third wave of legislation is called the CARES Act. This is a $2 trillion piece of legislation that includes all sorts of new federal resources, direct financial assistance to taxpayers up to $1,200 per person, $500 per child, 17 and younger, expanding unemployment compensation pretty dramatically, deferring student loan payments for all federally backed student loans, and waiving the tax on seniors who elect not to take the required minimum distribution to their retirement accounts this year, so providing them some financial flexibility, protection against evictions for renters and for closures for homeowners, as long as there's a federally backed mortgage, which often there is, either in your home or in the property that you may be renting from. And a measure to include COVID-19 testing is covered by every single insurance plan in this country without any cost sharing. Billions, hundreds of billions of dollars of relief for small businesses, nonprofits, tribes, and others through a new program called the Paycheck Protection Program that's administered by the Small Business Administration, and more. We'll talk in greater detail about some of these programs. And I just want to say that even though we have done a lot already at the national level, I'm not at all satisfied with our national response to this crisis. I've been calling on the president to make more full use of the Defense Production Act so that we can step up production of testing. We are woefully behind where we need to be on testing, but we also need more medical supplies. You hear a lot about ventilators, but it's more than that. It's masks, it's gloves, it's gowns. And we need to do all of that. The Defense Production Act can help us do more and help us do it faster. And I'm going to continue pushing on that front. I'm calling on the Treasury Department and the Small Business Administration and other federal agencies to do a better job of getting the resources Congress has provided out the door faster to the people who need it most. This program is not yet working the way Congress intended. And it's unacceptable also that the IRS is now saying that if you don't have direct deposit with them for your tax returns, that it may take 20 weeks or more to get those direct individual assistance checks. We've got to do better than that, and I intend to keep pushing. Finally, I'm calling on my colleagues in Congress to do more and to do it quickly, to provide more support for hospitals, states, local governments, employers, and families across this country. And in order to do that, I happen to believe we need to get back on the field. Congress has been on an extended recess for the last going on a month. And while we're working hard, we're trying all the workarounds on conference calls and Zoom meetings and things like that. It's not the same. We need the full House of Representatives, and I believe the Senate, on the field at full speed. And I think a combination of bringing some of us back to the Capitol with proper distancing and also using some technological tools can allow us to do that safely while also fulfilling our constitutional responsibility. So I'll be pushing on all of that. And with that, I want to get to your questions. And so we are joined, as I said, by these great panelists, and we're going to start with the questions that we have received in advance. I will be turning to my district director, Jenny, to ask those questions. But before I dive into that, let me just remind everyone that there's a whole bunch of resources on my website at huffman.house.gov. You can find my district office phone numbers there as well, and we want you to be in touch. We want to be a resource for you on all of these matters that we'll be discussing tonight. So Jenny, why don't you go ahead and fire our first question, and we'll dive in.
Okay, I just wanted to let you know that there was a little technical glitch, so Facebook Live started a little bit late. So some people might have missed your opening, but
Gosh,
yes, your first
I
question.
won't do it all over again.
No. Your first question is from Dennis. With all the protocol around COVID-19 in hospitals, elective surgeries have been all but canceled. This impacts rural hospitals severely as elective surgeries cover a significant amount of hospital overhead and margin. What is the federal response to keep our local hospitals whole? As we all know, Medicare reimbursements provide only a fraction of the hospital's cost of healthcare of delivery. These are some of the unintended consequences of the crisis that aren't so readily visible, like a restaurant or at a bar or a hotel, but everyone needs the help.
Yeah, great question, Dennis. So I have been in touch with several of my hospitals, and all of them are feeling the pinch from the elective surgeries that they've had to put off, from the bed space that they've had to leave open in anticipation of a surge from these COVID-19 cases, and they're hurting. So what I can tell you is that Congress has already made, I think, a serious commitment to backfilling our hospitals as well as clinics and other providers, but it'll have to be more. And I do understand that, and we want to make sure that the next wave of legislation includes the money to keep the lights on. One other thing I'll mention that we have done, Medicare often does not adequately reimburse hospitals, and there's often waiting periods and bureaucracy involved. We have, first of all, increased Medicare compensation for all medical providers during this crisis. We have also allowed hospitals to draw advance reimbursement payments from the federal government for the Medicare patients that they serve. And so I hope that also helps to manage the cash flow crunch, and we're going to do more. So appreciate that question.
Okay, the next question comes from Ken Wiederman. Why are we not doing mass testing for COVID? And why aren't we doing tier testing to know who has the antibodies? And what is the plan for this virus as it may mutate?
Great. Well, I'm definitely going to call upon Terry Frankovich, the public health officer of Humboldt County, to speak to this. But let me just add my piece up front. We are so far behind where we should have been by this point in the crisis when it comes to ubiquitous rapid testing. The whole premise of shelter in place was that it would stop the spread. It would flatten this curve, this viral curve, and that would not only prevent our healthcare system from being overwhelmed, but it would buy us time to roll out this ubiquitous rapid testing, which would help us manage future outbreaks. All of these weeks into the crisis, we're still not there. We're still rationing testing. I've got cases in different parts of my district where we've seen outbreaks in nursing homes, for example. Now, that's a place you would obviously want to be able to test every staffer, and if there's an outbreak, every single patient, and they can't do it because there aren't enough swabs, there's not enough reagent, there's not other aspects of the testing, and these vaunted rapid tests that we're hearing about from Abbott and other companies are just not yet available. So Governor Newsom, I think, has grown very frustrated with waiting for a national testing strategy and response. And he announced a few days ago that California would be undertaking its own initiative and that he would be dramatically increasing our ability to do all these things by the end of this month. That's a good thing. In a perfect world, we would have had leadership from the federal government that had brought us much further down the road on testing by this point. It hasn't happened. And you're still not seeing, as I mentioned, the Defense Production Act invoked to help solve this testing problem. But the state is stepping up. I know that my local health providers are stepping up in every way they can. Many of my counties have gone direct to Abbott and other testing companies to procure this capacity. But let me hand it over to Terry Frankovich to give us some more perspective from the medical perspective.
Hi, thank you, Congressman. So testing has been an issue all the way along, as you know, and from our standpoint, a couple things I do want to remind people about is that, you know, public health and labs in general are not built to be high throughput labs. That typically has been the province of large commercial labs, which are set up to run thousands of specimens. So that being said, our public health lab, I think, has done an amazing job of testing individuals. And in fact, when you combine our local lab as well as the commercial labs, we've tested over 1,400 people now in Humboldt County, which is not what I would like, but certainly better than many areas have been able to manage based on resources. So I think that, again, to the question of mass testing, we would love to be able to do broad surveillance testing, but frankly, in order to do that, we would likely need outside resources. We're talking, you know, state or federal mobile test units, that type of thing that would allow us to do that. In the meantime, we've been working on building our internal capacity. And as you are aware from our discussions, we do have some equipment in place that we could use to increase some productivity, and the access to reagents is an obstacle, pure and simple. And so we get in every line, every queue that we can to procure things. And we get some things coming down. We've had some success recently with looking like we can access some additional things for a piece of equipment in our lab that would augment our efforts. But again, it's really supply driven. And so, you know, I can only tell people that as we access increasing reagents and different test modalities that we can use, we are ramping up our internal capacity as much as we can. Point of care testing is something that is available potentially in our community in terms of the equipment to do the test. But again, the reagents are the limiting factor. And so we're working with both the state and directly with the companies that produce these reagents to be able to help support point of care testing in hospitals, for instance. So it's a work in progress.
And you're doing a great job, Dr. Terry Frankovich. I should give you a shout out as well for joining me earlier this week on a phone conference of all of my public health directors in all 6 counties that I represent. It was a great chance for them, I think, to collaborate, and we were able in that call to identify the fact that the same component that Dr. Frankovich needs in Humboldt County is needed and is a bottleneck in Sonoma County as well. So we've been making some calls to try to find a way to get you more of that so you can ramp up more testing. I don't know that we've had that breakthrough yet, Dr. Frankovich, but we're committed to doing what we can to help you.
Thanks for that. And to the other question that was asked about antibody testing, it's a really good question. It's a really important piece of information we need to develop across the state and the country. Right now, there really is one antibody test that's FDA licensed, approved basically for use. And there are a lot of, I just want to make people aware, there are a lot of entities that are billing themselves as having the ability to provide that testing, especially things like home testing and all sorts of things, which it's really important people understand these things need to be vetted. There are a lot of people, I think, who are aiming to make some money out of the situation and don't necessarily have high quality or reliable tests, which is really problematic. So just be aware that we're watching this as well as the state. And as things become available, we have every intention of pursuing that ability to access that testing for area residents.
All right. Well, thank you very much. Next question.
Okay. So the next question is from Robert A., who is writing to find out what website he could use for details about immediate relief for small business owners to receive the federal loan and to keep the employees working.
So, Robert, thanks. We want to get these tools for small businesses out to as many people as possible. A couple of suggestions for you. There's a resource section on my website. If you want to go to huffman.house.gov, you will see it under the Coronavirus Resource Kit, and it includes some links and some resources relative to small businesses. But the SBA website is terrific. And if you go there, you are going to see all of the frequently asked questions. You're going to see a very helpful tool where you can enter your zip code, and it will tell you instantly all of the different lenders, community banks, credit unions, big banks, everyone in your area who is participating in the Paycheck Protection Program. So check that out, and then try to get into the program with one of those lenders. We'll, I'm sure, have some more questions and have a chance to talk to Leila and Gregg about some of our frustrations at getting that money through these lenders out the door to small businesses. But the resources are there. Between those 2 websites I just shared with you, you should at least be in a good starting place to get connected.
Okay.
Next.
Sherm Frederick wants to know, can you please address the mask controversy? How is it that for a month, public health officials told us we didn't need to wear a mask, and now it's mandatory? What gives?
Well, I'd better go back to Dr. Frankovich on this, because I myself was kind of surprised that initially it seemed to me like wearing something like this would be a good idea. It would prevent you, since we always heard about the droplets causing the spread of this virus. What a great way to prevent you from coughing or sneezing or breathing droplets into the air. But it was pretty late that we received this additional guidance, so we should all be doing that. Dr. Frankovich, do you have anything to explain why it took them so long to figure this out?
Sure. It's certainly a reasonable question, because you're right. We were, as a public health community nationally at the state and local levels, we have been following the guidance suggesting that while masking and personal protective equipment was important among our healthcare workers and such, we were not advocating general masking for the public. I think what's important for people to remember is that, the knowledge base on COVID has just been evolving fairly rapidly. I mean, when you think about it, I mean, this started with the case, the first reported case in China on New Year's Eve, I believe. So in a few months, we've come a very long way in our understanding of this, and there's still a lot more to learn. I think, the idea of the public masking is, again, not to protect the wearer. And I think that that was, one issue early on is we felt that, from a personal protection standpoint, this may not be the best tool. And also, of course, there was concern about drawing the masking availability away from healthcare workforce, et cetera. But I think what we're learning about this is that that idea of my mask protects you and your mask protects me, and decreasing that asymptomatic shedding, which is a really relatively new understanding about this virus in terms of having some really good data about it. That is the rationale for making this change, is really just to decrease the amount of virus that is sort of out there and circulating in these public spaces based on primarily asymptomatic shedders, because everyone else should be at home.
Yeah,
So,
there was a lot of initial confusion originally around the N95 mask, which is the more protective respirator that prevents the viral particles from coming into you, and the lesser masks that prevent your virus from being spread to others. And that too was, I think, causing the confusion. But we began learning pretty early on that Asian countries, and I don't know if this is by way of public health directives that they impose or whether it is cultural, but you see a lot more masks when a flu or something like this breaks out in many Asian countries, and their curves were flattening faster than ours. So, Dr. Frankovich, was that part of what contributed to the CDC's conclusion, you think?
well, yes, I mean, obviously, in the public health realm, we're watching these examples, as everyone is, from other countries and what seems to be successful. How much of any country's success can we pin on things like widespread testing versus things like universal masking, and how do you separate out those effects? I think in the end, the bottom line we come to is there may be some benefit, and there seems to be when we look at some other countries, and that being the case, it's reasonable to adopt as another strategy in our arsenal for doing this. And I do want to mention again that I've been trying to emphasize the idea of facial coverings as opposed to masking. So, that concept that a scarf, a bandana, those kinds of things can also serve as this barrier, so that the ability to purchase a mask or to make one yourself doesn't have to be a barrier to abiding by this recommendation, which again is a recommendation here. It is not an order at this time.
Very good. Next question.
Okay. Minnie Wolf from Eureka is asking, what is your opinion about reopening the economy in some parts of the district? We in Humboldt have a low infection rate and haven't had a new case in 6 days. So why have we not reopened?
Very understandable question. All of us want to get everything back to as much normal as possible, as soon as possible. I would say two things. One, we are not where we need to be yet in terms of maintaining a zero spread profile. And I'll invite Dr. Frankovich to speak to this as well. But you not only want to bring the numbers down, you want to get to the point where it's not spreading. And the last few days look very good in Humboldt County, by the way. There's been a flat line, no new cases for, I think, 4 or 5 days in a row, which is terrific. But that's not the case elsewhere in the region. And when you open everything back up, people start moving around again. And that's the other part of this. As much as you might think you're behind the Redwood curtain and not subject to the same conditions as the Bay Area, for example, people are going to start moving around a lot more if we just reopen things. And we want to be careful to knock down that curve throughout California, ideally throughout the country, before we do too much relaxing. But Dr. Frankovich, please fill in anything I left out.
Well, I agree. I think it's a really good question, and we recognize the cost societally of having things as restricted as they are right now on all kinds of levels, including sort of just general health equity issues. But I think that it's important to realize that while we're eager to be able to kind of move forward and ease some restrictions in light of these recent negative tests and some decrease in general in many areas of the state, that the virus hasn't disappeared. We've just made it harder to transmit it by having people at home. And so really any move to ease the shelter in place has to be done with a lot of solid and informed planning, with the recognition, as you alluded to, that what one area of the state does has an impact on other areas because of issues like travel. And so I can tell you that there is a lot of talk and planning right now about what preconditions would need to be met in order for us to be able to do that kind of move forward. And then what would be the indicators that would cause us to have to move backwards again. And so it's really an important discussion that's ongoing. I want to reassure people that there is a lot of planning on this at the moment and thought about how we can do this. And again, I would want to point out that we know the incubation period of this virus is about 14, can be up to 14 days or so. So 7 days is great, but it's important that we're watching this going forward. And meanwhile, doing all of those preparedness pieces that at the outset, we had no idea how long we'd have to put in place. And we've been really working hard on, but it does give us the opportunity to ensure we have things like adequate PPE everywhere, adequate capacity built up locally so that if things do ease and we're seeing an increase in cases, we'll be well prepared to manage that.
Well, and Doctor, we should probably speak to the notion that we simply one day flip a switch and reopen the economy, because I think it's important to manage expectations.
Absolutely.
From my discussion at the national level and with our local public health leaders, it won't look like that. It will be a gradual transition to something that's more like a semi-normal. Did you, Doctor, want to discuss maybe a little bit about what that might look like?
Well, I completely agree. I mean, you're absolutely right. It is not just a mere issue of do we just, abandon shelter in place and move on. We have to look at all kinds of features of this in terms of how can we gradually ease things to allow some mixing of people, some, increase in activity in our community, while still protecting those at highest risk of severe disease, those most vulnerable due to age or health conditions. And it's clearly a balancing act, but you're right, the initial changes will be smaller and will be expanded as we see what happens once those are put in place. But again, we need to make sure that on the ground, everyone is ready to manage whatever, those changes that occur as a result of our easing of any restrictions.
Great. So let's go to the next question. Jenny, I want to try to get Leila and Gregg into this conversation.
Exactly.
You got a small bit. Okay, go ahead.
Perfect timing. So North Coast News just asked
Okay.
for a response from Leila and Gregg on 2 questions about business. They want to know what would need to be in place in order for the businesses to reopen and for the economy to start, and what do the county businesses need to be equipped in order to do this? And secondly, what can non-essential businesses do to survive the long-term closures and with the SBDC running low on funding?
Okay,
Are there
2
local
great
solutions?
questions. So we'll start with Leila and Gregg. 2 questions I'm hearing. One is, what do you think the business community needs in order to get ready to have some normalcy restored, understanding it's likely to be gradual? And then what are the most critical tools to keep the lights on for the non-essential businesses that are still subject to this shelter-in-place requirement?
Thank you for the question. So I'm going to weigh in first, and I want to point out that this is a combined business recovery and public health question. What it's going to take for businesses to be able to reopen if they are not currently labeled as essential services has to do with whether or not we can ensure, to whatever extent it's possible to, that folks are getting tested when they need to get tested, that there are rapid reagent tests as well, and that all businesses, once they reopen, know how to practice whatever safety practices are going to protect their employees and their customers. So I'm perfectly happy if Teresa wants to weigh in on that aspect of it. And I do want to point out that as things change, and sometimes this is day by day, I really want to recommend that folks call the business services hotline that Humboldt County's Office of Emergency Services has put out there. I'll look it up and I'll name it in a moment. Because if somebody is confused about how to operate safely, when to reopen, how to reopen, that is a good place to start. And then on the second question, I'm happy to punt this back and forth with Gregg, but my recommendation is anticipate that once you are ready to reopen, please, I want you to be ready from the get-go. I want you to have laid out your plans for everything that you're going to do. Whatever deep clean you want to do, schedule it now, plan for it now. Whatever employees or contractors you need to have in place, tap them, make sure you've got a plan for rapid turnaround. And if you need funding, well, let's talk about the funding. The SBA lending program has been really, really tough for folks to apply to, get answers from. I want to acknowledge that openly.
Yeah.
And it's our job as the Small Business Development Center to help you to navigate those loan processes and applications, to run your numbers, to figure out what your real financial situation is now. But I also want to point out that this community is coming together in a way that I find really extraordinary and really important, especially for a rural community that's had trouble tapping the capital that we need from federal and state levels. There are already emergency bridge loans available from a number of our local banks and credit unions, as well as our community development finance institutions. The County of Del Norte has come up with a business stabilization loan fund. The city of Arcata was the first with its own emergency bridge loan, and there's more coming very, very soon. So I just want to acknowledge that there are community members and community leaders and lenders right here who are stepping up to fill in the gap until folks can access their federal funding. Gregg.
So I will kick in just here for a minute. And that business line at the County Office of Emergency Services is 268-2527. And if you call that number, you can get answers. That's there's two numbers. There's a public number. That's the business line.
Say that again, Gregg. It says 707 what?
268-2527.
Thanks.
So, just to add to what Leila said a little bit, what hurts us here, of course, is not knowing, quite honestly, because that's a public health decision on when things will get back to normal. And so, everything she said about being prepared is great. You just don't know when it's going to be, and that goes for us too. I mean, we're we had the same notice as everybody else, and we literally had to scatter our operations. We have 4 employees, and we're all working out of our own homes, and at the same time trying to manage this crisis. What we did at REDEC is immediately start looking at the timelines. We're primarily lenders, and we started looking at the timelines and saying, well, if it's going to be a number of weeks, 4 to 6 to 7 or however many weeks it's going to take to get the SBA loans in place, some of these businesses are going to need capital right away because they just shut down. And so we put a business loan program in place that we were initially just servicing our existing customers, and so we've lent about $300,000 or so in the last week and a half to our own customers. But now what we've done is we were able to secure funds from the Humboldt Area Foundation, the Headwaters Fund. We're working with the City of Fortuna, and then our own funds. And we're going to open up that program in a day or two to to people who aren't already our customers at Redwood Region Economic Development. And those loans will be $25,000 as a maximum, with a 6-month deferral at 2.5% interest. So they're pretty low interest.
Yeah.
And the goal of that is to provide some operating capital. So while you're waiting for your larger SBA loans or loan guarantees through the PPP program, then you have some operating capital. Again, we don't have a lot and we're pretty small, so we're going to do the best we can to get that out in the next day or two.
We may get you fully subscribed just from the folks who are watching this.
I suspect so. Yeah, I warned my staff this was going to be happening.
But that's fantastic. I mean, you gave the phone number. Any other contact information people need? Because this is a lifeline. This is a bridge line. We know that there are problems with the rollout of these SBA programs, and in the North Coast, you have a lifeline here. Some of you, at least. And we want to make sure you know how to get it.
Yeah, and so the city of Arcadia with Arcadia Economic Development Corporations is doing something similar. And again, it's a lifeline, and it keeps you afloat while you're waiting for bigger dollars. I would recommend something else, which is enrolling with the North Coast Small Business Development Center, and they're online. You just can Google them and find them, because the financial planning as you move forward is going to be critical. And here's the issue. A lot of these companies and small businesses may be carrying some debt anyway. And so while they've gone to a negative cash flow situation here, the new help they're getting is primarily more debt. And so it's going to be really important. Even though the debt may be reasonably priced, you may have a long time to pay. You are still going to be carrying debt upon your existing debt as you go forward here, and that's really going to be an issue that many businesses will have to deal with going forward. So,
that's a great planning. Leila and her colleagues at SBDC can help walk folks through the planning aspects of how to manage existing debt, whether to take on new debt. There are also some grants available, emergency response grants through the SBA. So your point about getting that advice is critical. Appreciate that.
Jared, if I can weigh in very briefly, because I do consider us a lifeline, and I want to make sure that folks understand that the North Coast SBDC has taken the responsibility of being a center of information as well as business consulting. So I really want you to visit our website, and I really want you to sign up for our regular updates, because we are compiling absolutely anything that we can find that we consider credible and helpful. And we're pushing it out to people who are or are not our clients. So that website is northcoastsbdc.org. And what that means, of course, is, we've got a core of about 20 business advisors who are spending dozens and dozens of hours a week face-to-face via Zoom with clients, trying to walk them through everything that they're struggling with. And we're staffing up, but we are responsible for keeping folks informed as well as coached and supported. So please reach out to us, because that is exactly what we're here for. And if you're applying for many of the local emergency bridge loans, they're going to expect you to have been working with an SBDC advisor to make sure that you are navigating this with the best help possible. So thank you.
Yeah, in fact, that is one of the requirements of our loan, is that that you are enrolled with the SBDC or in that process. And we really also want people to be applying for the SBA loans and the PPP program, so that they don't really count upon us as a long-term funding. And as depending on how long this goes on, as people are getting their loan monies, we can be an eligible expense to pay us off. We can then re-lend that money to someone else, because we do have a fixed pot of funds here, and we could blow through it relatively quickly. And we would like to help as many people as we can.
I appreciate that. And thanks to you both, and thanks to the Humboldt Area Foundation for partnering with you on that. I'm sure we're going to have more questions about these SBA resources. So why don't we keep going, Jenny?
Sure. In the meantime, Justo Moscaso is asking.
Justo.
Say again?
That's Justo.
Oh, okay. Justo, I'm sorry. Wants to know about the USPS. There are a lot of questions in here.
Good.
In fact, one worried about the Postal Service. I'm sorry for my mispronunciation.
No. Justo, it's a great question. And I am hearing from constituents, because some statements have been made by President Trump and others that the hardships that the U.S. Postal Service is experiencing right now in this crisis may not find a lot of sympathy in the White House. I will tell you, I think there's still an awful lot of support and sympathy in the United States Congress. And there's definitely a lot of support and sympathy among the American people and the people that I represent. We want to have a healthy, strong, and I would argue revitalized U.S. Postal Service for generations to come. So I'm committed to making sure that financial support for the Postal Service is something we include in the next waves of legislation, and I promise you to do everything I can to make sure that happens. Next question.
Okay, a KSRO listener is asking, do you know any resources for senior citizens without internet access who would normally go to libraries or coffee shops that are closed?
Wow, great question. Seniors that don't have internet access. You know, I don't, that one challenges me because social distancing kind of stands in the way of a lot of the things that I would advise you to pursue. So maybe the best I can come up with on the fly is to contact any of my district offices near where you may live. If there's something that you need from us that we can help with, to find a trusted relative. You don't want to have a lot of social contact, but if there is a trusted family member that you have been in contact with that can bring you information and maybe run down some of these leads on their internet connection for you, that sounds like a practical way to solve that problem.
Okay, a question from Ryan. Are deaths from other causes than flu-like symptoms dropping as we shelter in place, or are some like suicides rising?
Okay, well, that's obviously a question for Dr. Frankovich. What trends are we seeing in the North Coast, Doctor, in terms of other deaths and suicides were mentioned, but I've also heard that the social distancing we put in place has actually reduced the number of cold and flu cases we've seen in the healthcare system. You want to speak to these things?
Well, sure. What I can tell you is that, we've moved through during this course of COVID, just with time, we have moved through the bulk of our flu season. And so while I think early on, we were seeing individuals tested for COVID who actually were positive for flu. And so that has sort of faded. And as we all know, typically our cold and flu season is winter. And as we move into spring, we expect to see fewer respiratory illnesses overall. With COVID, my suspicion is that when we begin to see an increase in respiratory infections locally, there's a much greater chance that COVID will be the culprit at that time compared to other viruses, but we'll have to do testing to really know that. Right now, we clearly are seeing decreased influenza-like illnesses in our emergency rooms, and we are definitely seeing some decrease in emergency room utilization overall, partly because I think people are healthier at the moment in terms of those illnesses, and partly because I think people are choosing to not go to the emergency room with more minor health issues. And so that has decreased numbers. Of course, we still need people to go in if they have issues that are really of concern.
What about the mental health aspect? I mean, we are hearing about domestic violence issues with shelter in place, and the questioner, I think, was concerned that there might be depression and mental health challenges up to and including suicides. Are you seeing any data on that in Humboldt County?
Yes, honestly, I haven't seen any new numbers on those in terms of, trend lines. I think that obviously, we share concerns about mental health issues in our community, particularly with the stress of this situation, in addition to the somewhat limited resources at times because of workforce and that type of thing. So it's an important piece for us to be watching over time. I just don't have recently updated data to be able to convey to you right now.
Yeah, we're only a few weeks into this, so that's understandable. Next question.
Okay, another question from North Coast News. Are buses helping to spread the virus via passengers, and what can be done about this?
Okay, question is about public transit, and is this a vector for viral transmission, and what can be done about it? I hate to keep picking on you, Dr. Frankovich, but I think a lot of these questions keep coming into your wheelhouse. What do you think about public transit as a vector for spreading the virus? And before you answer, I mean, the second part of the question is what can be done about it? I will tell you what I think cannot be done about it, and that is to shut down public transit, because we have essential workers that depend on public transit to get around. They are hurt just as hard, and in some cases are asked to take great risks. So I think we should go the extra mile to make transit safe and to protect them. But we've got to keep providing what for many people is simply a lifeline to help them pay the bills.
Yes, certainly that was the intent of the shelter-in-place order, was to really focus on the continuation of public transit for essential workers, so that they're able to provide those services. And I think the measures on, for instance, buses are the recommendations that we're seeing kind of diffusely, which are, social distancing with seating, with lower total passenger loads, with ventilation, with signage about behavior, with all of that messaging about the transportation is not recreational, it is for essential work. Obviously, we've discussed air travel as well in the course of all of this, and again, that messaging has been clear that recreational air travel, this is not the time for that. But what we recognize is that air travel allows, for instance, some of our very critical workers to come in and out of the area. And so it's, it is again something that we cannot discontinue, but we do have signage at the airport, for example, about what is expected of people returning from travel.
Any thoughts about surfaces? I mean, we've talked about masks, we've talked about distancing. I know folks are also worried about, can they, if they have to get back and forth to work on public transit, can they sit in one of the seats on a bus without worrying that they're going to somehow be exposed to the virus that way?
Well, it's a good point. And, one of the other things is that issue about, asking on transit that there is frequent cleaning so that surfaces that are commonly touched are cleaned. We're also asking individuals, of course, to increase their frequency of hand washing or use of hand sanitizer to help protect themselves. The fact that we're asking people to mask is another effort to help decrease the amount of virus that might be present in those kinds of environments, as well as, again, the point about ventilation and distancing on those vehicles. So all of those things taken together can help to reduce risk for what is, in fact, a necessary service.
Thank you.
Okay. Lynn Glenn asks a question for the current town hall meeting. There in Humboldt County, there have been few or no additional cases of COVID in the last week. Is that because there are fewer tests being completed? How many tests have been completed each day this week compared to earlier weeks?
Okay. Doctor, do you want to give the trend line on testing capacity in recent weeks in Humboldt? I don't know if we lost Dr. Frankovich, but
here, I'm sorry.
There we go.
I'm having difficulty getting the mute off here. I was saying that in general, we've sort of put out our testing capacity as about 55 per day. And that was an increase from when we very first started, which was, I think, early March, where we were at about 20 per day. We believe our max, as we're currently outfitted, would be about 60 on most days. And part of that is simply because of the process of how we have to extract the samples, be able to set them up with the machine, do all of that, and then run the testing in batches. So what I can tell you is that we have seen some decrease in the amount of testing done, just I would say in the last week or so, perhaps. Although I think we had done 45 in this last reporting period, the last day or so. But I think that part of that is because in general, the emergency rooms, the physicians are seeing less respiratory illness that is confusing with the diagnosis of COVID. And so there's been perhaps less of that indicator. Because of that decrease, we are looking at other ways that we can utilize the testing, the little unexpected increase in our testing capacity in terms of some surveillance. So that's what we're working on internally to use this little slow period to be able to do.
But you don't think that the fact that Humboldt has had several days in a row of no new cases, that's not because you're doing less testing, I think is what.
No, it's not because we've restricted testing further or made it more difficult to access that testing. I think it probably relates in part to, as I said, to just the sort of decreased number of people presenting with the symptoms that would make their physician inclined to test.
Okay, thanks. Next question.
Okay, well, Sarah wants to know, will all states be able to vote by mail in November 2020?
Great. Sarah, I'm so glad you asked this question. She's asking about a national vote by mail program. And I mentioned several things that Congress has to do. We got to provide more funding for a number of priorities. We've got to make sure that the long-term economic revival, including infrastructure, is adequate. But we also have to anticipate that this public health emergency may still be with us or might come back to us next fall. And we have to protect the national election. We got to make sure the election is secure. And we've got to make sure that something like what we saw recently in Wisconsin never, ever happens again. And what I'm talking about there is because there was a lack of planning ahead. This shelter-in-place requirement was imposed, and they moved ahead with an election under the same old rules, which forced people to make a terrible choice. Do you exercise your constitutional right to vote and put your own health and others' health at risk? Or do you stay home and not vote, putting our democracy at risk? That's just a choice we should never ask anyone to face. And so I am pushing very hard to make sure that we have contingency plans in place for the November election, that we include adequate financial support for states to move to all mail balloting, which works. We have entire states like Oregon that do it. And you actually don't see fraud. And in fact, the indications are you see less fraud. And one of the reasons it's more secure and more reliable is that there's a paper trail. That absentee ballot can absolutely be traced to every single voter. So it makes sense from an election integrity perspective, and certainly from a public health and planning perspective, to get moving. And we're going to have to do that right away, because plans for moving states to an entirely all-mail balloting program need to begin very soon. So I completely agree with the question, and we'll be pressing very hard to make sure we provide that support in one of the next pieces of legislation that we pass.
All right, there's another political question here for you. Jimmy T wants to know why you don't do your job and support my president instead of impeding his every effort to better America. Stop Gavin Newsom from turning California into a socialist state. We want to work and support ourselves, not depend on the government. No more divide and conquer.
All right. Well, Jimmy, we probably don't have the same politics. I'm judging from your question, but I also have a very different understanding of what my job is. I would push back respectfully on the notion that my job is to simply support the president. I would love to support the president where he's doing the right thing. And even in this public health emergency, I would have been very supportive of the president using the Defense Production Act, for example, to make sure that we are producing the medical supplies and the testing capacity that we desperately need. He would have gotten high praise from me had he done the right thing, and he hasn't done it. So I think my oath is to the Constitution and to the people I represent, and looking out for their welfare. That requires me sometimes to criticize and even oppose this president. And I will be doing that consistent with my own oath and my own conscience. The second part of that question, though, was, Jenny, refresh me on that last question. There was two parts.
Stop Gavin Newsom from turning
California. Oh, socialism.
Yeah.
Yes. So, you know, what's really interesting to me about this crisis is that it's sort of brought out everyone's inner socialist. There's different priorities that come to mind. And some very conservative Republicans are looking for massive handouts from the federal government for their favorite industry or for their favorite special interest. There's even one Republican, very conservative Republican senator from Missouri, who it's been written about lately, is calling for basically something like a government takeover of payroll for all businesses in the United States. Now, in any normal situation, that sounds an awful lot like socialism. In fact, it's sort of more than socialism. But in this crisis, I think we've just got to throw these labels away and think about what are the tools that our government can bring to bear to help get us through. I don't think we're in any danger of the United States turning into an actual socialist country. But if there are some things that can be done with our public funds, with our public agencies that save lives, that keep our businesses open, that help families and workers through a real tough patch, I'm all for it, and I'm not going to worry too much about the labels. Next question.
John Harper and a number of others are frustrated about the slowness of the money coming through PPP and EIDL, EIDL loans.
Right.
So, Congressman, I've had an application with EIDL, Economic Injury Disaster Loan, for 3 weeks, I've had with 3 for almost 2 weeks, and my bank stopped processing PPP. What's the plan?
Well, Gregg, this kind of gets to the point that you were raising, and I will turn back to Gregg and Leila on this question, but it is going to take some time for that SBA money to come through, and apparently it's taking some time to even process applications. So obviously the bridge loans that some of our local neighbors may be able to access would be one solution, but what else, Gregg and Leila, do you think needs to be said about this?
Well, there's was some, I think, confusion about BPP when it was announced. It was announced that the $350 billion were set aside for the PPP program, and really what that was loan guarantees, and so that meant you had to go to your financial institutions to apply, and not all financial institutions were actual SBA,
right,
were called preferred lenders, so they couldn't even participate, and that included a couple of the larger institutions here locally, and of course it hit those organizations very hard as well. So that was announced on Friday, April 3rd, that you could get these applications, and in fact the banks, there wasn't a whole lot of direction to the banks and credit unions about how to do that, and they weren't even staffed up for this huge onrush. And so I cut them some slack. I do know that some of our local banks and credit unions, the smaller ones, brought in people to work all weekend. They've been working at nights trying to process this absolute deluge of applications. And in fact, the capital is on the backside for those PPP programs. The banks only really access capital at the time of the guarantee. So they had to manage their own capital as well.
Hey, Gregg, can I stop you there?
Yeah.
Just to fill in a little bit of that, and maybe a little bit of a colloquy on that. So what you're pointing out is that there are some resources, grants, and some types of loans that flow directly from the SBA, but for the Paycheck Protection Program, it was decided to go through lenders.
Correct.
And that generally means banks and credit unions. This is a huge conversation we're having right now in Washington as we talk about augmenting and backfilling this program, because I think we understand it's not working very well. And part of it is because the big banks were able to kind of quickly jump in, but a lot of the smaller community lenders find it hard. They lack the capacity and they haven't had the same support. So we're really working on trying to make sure the next wave of legislation brings a lot more community-based lenders into the mix. Right. I just wanted to add that. And we're also working every day to try to bring new, smaller banks and credit unions into the mix. We've been able, my office has been able to help get approvals for just recently Redwood Coast Credit Union and Redwood Capital Bank. And we got more that we're working on online. So back to you, but I wanted to just fill in a couple of those details.
Well, that was it. So you mentioned Coast Central Credit Union, and they were applying because they weren't eligible to participate in the PPP program, and of course they're a big institution up here, but they did get approved last week. So that's great. So those institutions are really powering through it. So what we tried to do at REDAC, and again we're expanding this program very soon because we're literally a 4-person shop, all working out of our homes right now. And so we do want to have those short-term loans. Again, Arcata Economic Development Corporation is doing the same thing. They're based in Eureka as well. And we both cover, I cover all of Humboldt County through REDEC, and then they cover 6 counties. And the goal, again, in the city of Arcata did this, the goal is that short-term funding to help keep you alive while you're going through the SBA process.
And this question is specific to the delay in getting these resources available. I'm certainly hearing a lot about that, and I'll invite Leila to speak to what advice she wants to share with small businesses who are confronting that delay. But I do want to share at least a little good news along with all of the frustrations. There are several Humboldt County small businesses that have actually gotten their money. And the North Coast Journal is a good example of that. There's a handful of others we've heard about just in the last few days. So some of this money is finally starting to flow. Leila, I'll let you jump in on the issue of managing the delay.
Yeah, thank you, Jared. So I think the direct answer to John's question, and I appreciate that he posed it because he's not alone, is you're not alone.
Yeah.
The vast majority of economic injury disaster loan applications, that's the loan money coming directly from the Small Business Administration to businesses, are still holding on, waiting to get their answer. But there are a couple of bits of information that I'm trying to get out there and make sure that people understand.
Oh gosh, she left us in
there,
vain.
She had set that up so well. There were really
cliffhanger.
Yeah, we're going to come back to Leila as soon as her internet connection is restored, because she was going to advise us on some critical considerations for folks managing the delay. But her initial response really brought out an important point. We've got to keep these different SBA tools distinct from each other. And even I was sharing the good news of some folks that have gotten Paycheck Protection Program loans. Those are separate from the direct disaster loans that you get with the SBA. So each of these tools is just slightly different. And folks like Leila and Gregg can help you kind of navigate the differences and figure out what works best for you and how to best utilize them. Jenny, you want to tee up the next question?
Yeah, I've got a couple more here. So Mark Sailors and others are having problems with Wells Fargo. Wells Fargo told them to wait until the 10th to apply, and they're suspicious that means the money won't be there. What's going on with Wells Fargo?
Yeah, Mark and I have spoken on Facebook about his challenge, and many others are in the same boat. Wells Fargo, if I could be very blunt, has been jerking a lot of people around. They initially ran into a cap on their lending capacity. Now that cap is because they got into all kinds of legal trouble by jerking consumers around for years before this. But the Federal Reserve granted them a waiver of that cap. There is no reason they cannot continue to enroll folks in the Paycheck Protection Program if they want to. And let me just emphasize that all of this money is federally guaranteed. So at the end of the day, there's no excuse for a big bank like Wells Fargo or any other big bank saying that we're capped out, or we don't have capacity, or we've got to start having these arbitrary restrictions on who can get this and how much they can get. This is federal money passing through the banks to you. That's what Congress intended. And I am happy to join with my colleagues. We're doing this right now to push back on the big banks that really aren't playing fairly when it comes to administering this program. Gregg, did you want to add anything to that? Or if I got any of that wrong, please feel free to correct me.
No, I would. No, I think that's right. And I think one of the points is we are now in our 4th week of this. We're building the airplane while we're flying it, and so I think through all the best intentions, the SBA and others rushed out to try to get something on the ground. And the practical reality is that there's a number of us here right on the ground working directly with businesses who had some questions about how things worked and different things were changing. In a normal situation where we had a disaster, someone like us or SBDC, we would be in our offices, we'd have, everything set and would not be necessarily affected by the disaster. And I think that goes true, but this is a 50 state, every county, every city, every town disaster. And so we're trying to build the aircraft while we fly it. And So I understand the frustration. I think that that it is, every week that we've been working on this, every day we've been working on this, I think we've been seeing improvements in the processes getting in place. But it's hard, we literally, again, I mentioned it earlier, our organization is 4 people, and we're working in 4 different locations right now trying to respond to this crisis.
Well, so some of the feelings of being overwhelmed, I can understand. It's small banks and lenders that are trying to
Right.
come up to speed. Um, and it is a huge amount of money that's being stood up really quickly, but I'm less sympathetic to the big institutions where frankly, we are running into a lot of our problems. They have the capacity to get
Right.
this right. And we have to distinguish between the inherent challenges of rolling out a new program and folks who may be gaming the system. And I'm worried about the latter category because literally from the very first, I started hearing about one big bank that was only making this available to its existing business lending customers. Now, you can understand why that sounds a lot like they were shoring up their own lending portfolio instead of doing what Congress intended, which was to push this money out to the people who needed it most. We continue to hear anecdotal accounts of big banks actually soliciting some of their big business customers and pushing these programs on them, even if they don't need them. That's not what Congress intended either. So certainly in the next rounds of legislation that you see out of Congress, I'm going to be pushed, and I hope we're able to deliver some reforms and fixes to prevent the abuse and the gaming of the system while we try to find new partners out there at the community level to push this money out faster and better to people who need it. Gregg, I'll give you a last word on this, and then we'll go on to the next question if you have anything to add.
Well,
Actually,
I think
I'll take
that's
the last word if you don't
Oh,
mind.
Leila's
go ahead, Leila. Leila's back.
Yeah, so I want to reinforce that the politic answer is we really appreciate the way the lenders who partner with us have been responsive to us and our clients. And I know folks have been working 24/7 and through the weekend to get these paycheck loan applications processed. That said, I personally want to thank you and offer appreciation for any legislation that shores up and supports a strong infrastructure of local banking, local credit unions, locally controlled decision making. I think that that's healthy for this rural community in particular now and for the long term in an emergency or not. So thank you for that, Jared.
Oh, amen.
Well, and
We
I'll
lost your
add to
connection
that.
earlier. Did you want to finish the thought that you were cut off on earlier? Or
Yeah, 2 points.
Good. So economic injury disaster loan applications, if you have not put yourself in the queue, even if you don't know whether you're going to want to accept this money, get yourself in the queue anyway, because you might find later that you accept it. You might find later that you don't. No harm, no foul either way. And it really is now a much simplified application. So if you visit covid19relief.sba.gov, there's the application right there. It's kind of a pain in the neck, but it is absolutely worth it. The second thing I want folks to know is there's been a lot of kerfuffle around the element of the EIDL, Economic Injury Disaster Loan Program, touching on the $10,000 up to $10,000 advance. So I know some business owners who were watching and listening know what I'm talking about. They want that $10,000 advance. They want it within 3 days. And now they're finding out that it is up to $1,000 per employee, including the owner, not a flat 10,000. Be clear about that because that's new information. And the second is it's not coming in 2 or 3 days. It's coming in more like weeks. So that is the reality. The second thing that we've been hearing from folks is, some people got an email from the Small Business Administration saying, listen, I'm so sorry, but your loan total is not going to, automatically come up to your 6 months of operating expenses. We're trying to spread the wealth. And so you're only going to get a max of $15,000 in addition to that up to $10,000 advance. That's actually an erroneous email. So if you got that, this is hot off the presses directly from our SBA contact this afternoon, which, made everybody's eyebrows rise. That is apparently not the case. The SBA is not saying that folks are going to be capped at 15,000. They're saying continue to apply for everything that you need. And then finally, the last thing I'll say is if you did apply for this loan program on or before March 29th, I want you to go back and I want you to do it again, because that's going to get you into the upgraded system, which will make sure that you have a confirmation number that begins with the number 3 and hopefully reduces your wait time.
Wow.
But again, John, you are absolutely right. Everybody is in a holding pattern. That said, everybody's in a holding pattern, and yet the SBA has been able to approve and start pushing out $160 billion worth already as of this morning. So they're humming along, but we're all worried and frustrated. And I tell you, looking at the intake queue for SBDC Business Advising Services reads to me like a phone book. It looks like the yellow pages. It is really scary. And we just got to be clear about that.
And I want to make a point about that letter. And you know, I texted Leila over the weekend because we're all working 7 days a week now. And that letter came out about the 15,000. I said, what is this? And we went back and forth and I think then went and opened up another bottle of wine at our respective houses. You know, to everybody who, you know, there's with social media, there's obviously a dark side of a lot of false information out there, both health related and even, you know, around the business. And I would say go to the official sources. And for us in Humboldt County, certainly that's the North Coast SBDC. We started a group that started doing Zoom calls even before the shelter in place order. Where we coordinate 3 days a week now. We coordinate there's usually about 30, 35 people on the call, and we're coordinating all of our information and response, and we're checking in regularly. And one of the things we decided was to try to funnel as much of our information as we could into that North Coast SBDC website so that it's accurate and it's sort of the clearinghouse for Humboldt County, certainly, and Del Norte. Humboldt County and Del Norte business information, and that includes accurate information on what's actually happening with the SBDC, or excuse me, SBA programs. So, you know, keep checking that. You know, a lot of us have just taken our web pages individually and pointed it towards that page, you know, put a lot of burden on Leila and her staff. But I think it was great to have a single source that we could rely on in the region. Both as service providers, but certainly as businesses as well.
All right,
so
great points. Some really good points. And Leila, yours was a very timely.
Oh, it looks like they muted you, Congressman.
Sorry, Jared, you're done. You don't get to speak anymore.
The staff's taking over down there.
Sure.
There we go. Much better. Much better.
All right. Jenny, how many more questions can we take?
Congressman, you've extended this by another 15 minutes.
We're way over the 1 hour. I hope it's, I find this incredibly valuable. Our panelists have stuck with us for some extra time, but let's take one more question.
Perfect.
I got nowhere to go.
Perfect. And we appreciate you doing that with the technical difficulties. So Kirk is commenting, and it kind of begs your response. Testing, tracing, and treatment using the Defense Production Act is essential for moving toward our new normal, which begins with testing essential workers. Hopefully, Gavin Newsom will lead us out of the shelter in place ASAP and set examples for all states if the federal government continues to avoid leading our nation out of this pandemic crisis. Can you comment?
Yeah, I couldn't agree more. I really think testing and protection are kind of the two urgent priorities right now. And it's because all of us want to get through this as quickly as possible, but we also want to get through it in a way where it doesn't just come back to us a few months from now, which would be even worse than continuing for a few more weeks with the hardships of shelter in place. So these are tough decisions. I place my faith in the public health professionals who will tell us when it is time to safely begin transitioning to a gradual, semi-normal state. We're nowhere close to having the kind of ubiquitous rapid testing that we need, I think, to feel comfortable going there yet. But I take Gavin Newsom at his word that he is owning this testing challenge, that he's going to deliver huge new resources by the end of this month, and that's great news. we've got to keep working on the protection side as well. I'll just share with you that today I had a very positive experience because I was able to work with actually a Humboldt County manufacturer, I won't mention who, but a company that wants to repurpose and has begun repurposing through its Canadian affiliate their manufacturing capacity to make medical gowns, which are in short supply. Canada quickly approved that, and it's working. Thousands and thousands of medical gowns are being made. But here in the US, they can't get their phone calls returned. And I was able to jump in and make some calls to connections at FEMA and FDA. And it looks like we may be on a fast track to getting that approval in place. So it's gratifying when you can do that, but it's also frustrating that we still don't have a national strategy and a top-down, well-led effort to provide all of these essential supplies so that we can protect medical workers and first responders and others. We're going to need to get that ironed out in the weeks and months ahead. I think with that, we will bring this town hall to an end. Thanks to everyone who joined me on the various mediums. Thanks to our fantastic Humboldt County panelists, to Dr. Frankovich, to Leila and Gregg for your expertise. I hope everyone will tune in to our weekly office hours Wednesday at noon on my Rep Huffman Facebook page. And this broadcast will be posted in its entirety on my website, along with lots of other important resources for you related to the COVID-19 crisis. You just simply have to go to huffman.house.gov. Thanks so much for joining me. We'll see you soon.
Thank you, Congressman.
Thank you all. Thank you, Dr. Frankovich.
Thank you.
Dude, Terry.